Hey everyone! Welcome to today's deep dive into urban health, where city life meets well-being. With more people living in cities than ever, it's time to explore how urban living affects our health. We'll unpack the fascinating insights from a document titled Navigating Urban Health: Challenges and Innovations in City Living. So what makes city living so unique from a health perspective?
Great question. Many people think of health as just avoiding illness, but the World Health Organization defines it as a complete state of physical, mental, and social well-being. That's especially important in cities, where countless factors intersect to shape our health.
That's a fresh perspective. It's not just about avoiding sickness, but fostering well-being in all aspects of life. One term in the document really caught my eye: urban health penalty. It sounds intense. What does it mean?
It refers to the way people in cities, especially in disadvantaged neighborhoods, often face worse health outcomes compared to those in wealthier areas or rural settings. We're talking about lower life expectancy, higher rates of chronic diseases, and increased exposure to environmental hazards.
Wow, so where you live in a city can actually affect how long you live and the health challenges you face. That's a wake-up call.
Absolutely. Socioeconomic factors like poverty, education, and access to healthcare play huge roles. And then there are environmental issues. Air and water pollution are well known, but did you know noise pollution is also a major health risk?
Noise pollution? I always thought of it as just annoying, not harmful.
It's much more than an annoyance. Studies show that chronic exposure to noise, from traffic to construction, can increase your risk of heart disease, sleep disorders, and even cognitive issues. And with climate change, cities face rising sea levels, extreme heat, and more severe storms, all of which amplify these health risks.
The example of Flint, Michigan really highlights how environmental injustice can devastate communities. It's alarming to think that some people are disproportionately affected just because of where they live.
Absolutely. And while cities often have the best healthcare facilities, they also struggle with rising rates of chronic diseases. Lifestyle factors like inactivity, stress, and limited access to healthy food play significant roles.
That reminds me, what about food deserts? The term came up in the document. What are they exactly?
Food deserts are areas, often in low-income neighborhoods, where fresh and affordable food is hard to find. Residents often rely on convenience stores or fast food, leading to poor diets and higher rates of obesity and diabetes.
It's not just about having food, but having access to healthy and affordable options. Are cities doing anything to fix this?
Definitely. For example, Philadelphia's Fresh Food Financing Initiative provides grants to encourage supermarkets to open in underserved areas. Community gardens and urban farms are also powerful solutions, giving residents access to fresh produce while fostering community connections.
Let's shift gears to mental health. The constant stimulation and stress of city living can take a serious toll. The document even mentions how urban environments might impact our brain chemistry.
That's true. Studies show that prolonged exposure to urban stressors can increase the risk of anxiety, depression, and even schizophrenia. But cities are fighting back by investing in green spaces, parks, green roofs, and tree-lined streets that help reduce stress and boost well-being.
I love the idea of green roofs. They're a beautiful way to bring nature into the concrete jungle. And social connection matters too, right?
Absolutely. Isolation can be a big issue in cities, but community centers, libraries, and public spaces can help people connect. Even events and programs designed to bring neighbors together make a huge difference.
And technology is stepping in too. Mental health apps are helping people access therapy and resources, especially when traditional care feels out of reach.
Exactly. While apps can't replace in-person therapy, they're valuable tools for bridging gaps in access and providing support.
Let's talk about some standout cities making a difference. Vancouver's Healthy City strategy is a fantastic example. They've prioritized bike lanes, walkable streets, and public transit, reducing car dependency and encouraging physical activity.
And then there's Copenhagen. Over half of all commutes are by bike, thanks to their cycle superhighways and protected bike lanes. These strategies improve air quality and physical health.
It's amazing how urban design can nudge people toward healthier habits. These initiatives don't just work, they thrive.
Still, we can't ignore systemic challenges like structural racism, gender disparities, and economic inequities. For example, redlining policies from decades ago segregated neighborhoods, leaving many communities of color in areas with fewer resources and higher pollution levels.
It's like a chain reaction. Those policies limited access to quality education, jobs, and housing, leading to long-lasting health disparities. Tackling these systemic issues feels overwhelming but necessary.
It is. The key is community-driven solutions. Cities must empower grassroots organizations with resources and support while addressing root causes like affordable housing and equitable healthcare access.
We've covered a lot today: the challenges of urban health, inspiring innovations, and the systemic changes needed to achieve equity. What's one takeaway for our viewers?
I'd say this. Everyone has a role in shaping healthier cities, whether through personal actions, advocacy, or supporting equitable policies. We can all contribute to a healthier urban future.
I love that. Thanks for joining us on this deep dive into urban health. If you found this valuable, please like, share, and subscribe, and let us know in the comments how you're advocating for change in your city.